Why pay $2.4 million for a drug that you can't even pronounce? Swizz Lux, all things luxurious living. If you're new here to the channel, welcome to the channel. Please consider liking and subscribing for more great content. Solidaris, priced at $678,392. This drug is used to treat paroxysmal nocturnal hemoglobinuria, an atypical hemolytic uremic syndrome blood disorders that results in the destruction of red blood cells. The dosing regimen for this drug can differ depending on the age of the patient and the condition being treated, but most patients need a maintenance dosage of about 1,200 milligrams every 2 weeks, which only a healthcare provider can administer. Because this drug comes with a high risk of infection, this drug is part of the REMS program, or the Risk Evaluation and Mitigation Strategy program. Ravita, $695,970. This drug is used to treat urea cycle disorder with this incredibly high price. Urea cycle disorders are genetic conditions that result in high levels of ammonia in the blood. If left untreated, they can lead to confusion, coma, or even death. This drug is dispensed in a pharmacy and doesn't require administration from a healthcare practitioner, where patients are typically given 132 bottles annually. The price of this drug increased by 4.8% this last January to $5,273 for one bottle. Blenkipto. This is the 8th most expensive drug with an annual price tag of $712,672. It is manufactured by Amgen and is used to treat a very rare form of acute lymphoblastic leukemia, a cancer of the blood and bone marrow. Only a healthcare provider can administer this drug, and dosing is done in cycles. The first cycle is known as the induction phase, is aimed at reducing the number of cancer cells. Cycles 2, 3, and 4 are known as consolidation phases, helping new growth of healthy cells. Patients need different amounts of medication during each phase, but will typically use about 168 vials per year. This list has also increased by 5.89% this last January to $4,242 per vial. Number 7. Brineura is a first-class medication that treats a specific form of Batten disease called late infantile neuronal ceroid lipofuscinosis type 2, CLN2. Batten disease encompasses a group of rare disorders of the nervous system. Specifically, this drug helps slow the loss in walking ability for pediatric patients 3 years and older. In January 2021, the price increased by 2.14% to $28,090 for 300 milligrams. This recommended dosage is 300 milligrams every 2 weeks, meaning that over the course of a year, it adds up to $730,340. Follotin, $793,870. This drug is approved to treat peripheral T Cell lymphoma, a rare blood cancer that causes death. A healthcare professional must administer this drug, and the patients are typically given 45 vials of this drug annually. The list price for a vial is $5,880, bringing the total annual cost to $793,870. Number 5. Luxturner, $850,000. This drug is the 5th most expensive drug on the list. It is used in gene therapy that treats an inherited form of retinal dystrophy, a condition that causes vision loss and even complete blindness. Luxturner cannot be dispensed at a pharmacy and requires a doctor to administer one vial of the medication into each eye. Patients should only need 1 dose of Luxturner ever, but the list price is steep, ringing up at $425,000 per vial, which you need 1 in each eye. Leptin, $889,904. This is one of the only drugs on this list that is dispensed at the pharmacy. It is used to treat leptin deficiencies in patients with generalized lipodystrophy, a condition of abnormal fat distribution in the body. The price of this drug increased this past February from $71,000 to $74,000 for a monthly supply. Patients self-administer Mylept once a day and typically use 14 vials per month, bringing the yearly price tag to $889,904. Danny Elsa, $977,664. The FDA just barely approved this drug in November 2020 to treat pediatric and adult patients with neuroblastoma in the bone or bone marrow. Danny Elsa was under an accelerated approval program, is considered an orphan drug and breakthrough therapy. However, this drug is by no means cheap. It costs $20,000 per vial, and each patient typically uses around 48 vials per year, bringing the annual cost close to $977,664. Kinvi is a new addition to this list. It was just barely approved by the FDA in November 2020 and costs a staggering $1 million a year. It is the first treatment approved by the Hutchinson-Gilford-Progeria syndrome, a rare genetic disease that causes premature aging. This is an orphan drug, which means that the disease it treats is so uncommon that pharmaceutical companies typically don't develop medication for it without some kind of government assistance. It's also a breakthrough drug, which is defined as a medication that offers a major improvement over other treatments for the same condition. Although the dosage depends on body surface area, patients typically take around 200 milligrams of this drug a day, and at $717 per milligram capsule, this adds up to $86,000 a month. Zolgensma, $2,125,000. The FDA approved this medication in May 2019 and has remained the most expensive drug in the US, with this list price of $2.1 million for a course of treatment. This drug is approved to treat spinal muscular atrophy, a rare childhood disorder that causes muscular erosion that can lead to lung infections and muscle weakness. It is a one-time curative therapy, and many children who have been treated with the drug now show no signs of the disease. Paying for this drug isn't easy, as insurers may not cover it, and most don't, or they may have certain requirements in order for patients to qualify for coverage. If you enjoyed this video or learned something new, please consider liking and subscribing. Thanks guys for watching, and I'll catch you in the next one.